Hi, everybody. I'm jumping on to talk a little bit about finding primary care and how to help get a diagnosis and work through your primary care provider and even another interested specialist to help get your diagnoses. This could be a very long series, and I would love to get together and do like a group class on this because, especially being on the spectrum, getting to see you guys and see how you're communicating, it helps me know more about how to help you advocate for the diagnosis you need. So it would be helpful and accommodating for me to do this in a group. For those who are interested, please let me know. Feel free. I put my email address out there all the time. In the meantime, let me do a couple of short tips from things that have come up in comments on how to do this. So the challenge with diagnoses, it's becoming a little bit easier, is that they switched some criteria around in 2017. You might have all heard that by now. And what that did is it created even more separation in our conditions and the idea of our conditions as being separate pieces. All right. Fortunately, the new book that I'll be doing a video on, I'm finishing that up after some sick kiddos. This lovely book for clinicians is advocating for what we all experience to be true, and some of the specialists I know certainly talk about with their patients quite often, is that it's not a set of separate conditions or a connective tissue issue with co-conditions. There is really one condition in place, and the dysautonomia issues, mast cell instability, even mild forms are all part of that, not separate. But because they're separate, that's created a place where the primary care providers feel uncomfortable with making diagnoses, where specialists feel uncomfortable working across disciplines to treat you. It made a bit of a mess. Yeah, fortunately, this book starts to apologize a little bit for some of that. So anyone can diagnose Ehlers-Danlos syndrome or hypermobile spectrum disorder. They are not two separate conditions. It is not a true statement that, oh, I have HSD, not hEDS. You can even tell that because look at the title of this book. Hypermobile spectrum disorders include hypermobile EDS, and it's currently their best way of describing, oh, here's what the body does. Even if it's not very bendy, there is some tissue fragility that leads to these other multi-system issues and other genetic types of malformations like median arcuate ligament syndrome, tethered cord, Chiari, that seem to go along with it. And you can have all of those and be diagnosed with hypermobile spectrum disorder. And so that's what I wanted to begin with today, is that's where I started. I didn't have any family members who were diagnosed, and if you didn't look at the right joints on my body, I didn't match. For me, the reason is injuries, some inflammatory arthritis that reduced flexibility through several of my joints, and a condition and a feature of EDS called dopa-responsive dystonia, where my muscles are too tense and too tight. So I don't have very frequent dislocations like my mom and my sister do, but had a lot of other inflammatory issues and injuries like inflammatory arthritis because my muscles were not having enough dopamine to relax properly through my body over time. Fun connections there. So until someone knew what to look for, I just worked with hypermobile spectrum disorder and found doctors who knew the full spectrum and could treat my symptoms anyway. So don't despise small beginnings. If you can get your primary, if they're not comfortable with hypermobile EDS, see if they'll do hypermobile spectrum disorder. A lot easier, less pressure for them, gateway for you to get things covered by insurance and to move forward. For an hEDS diagnosis, some people aren't even running the genetic panels anymore because it doesn't have a genetic test to associate it with. But you can get them to go to Invitae Genetics, which has instructions for ordering online on their website, and your primary care provider can go follow that and order the connective tissue panel, have you spit in the tube, send it back, and that will help. They also use the Beighton score, which is not meant to be diagnostic, by the way, and can include different joints. For example, if your thumb can't reach, which I can't anymore with arthritis, you can also have someone test your pinky. I'm going to hurt myself if I go further. You could test your pinky. You can look at other joints. Doctors who are comfortable with this have no problem just looking at other joints. The biting is not supposed to be that restrictive. If you can't convince them of that, then you might just be stuck with an HSD instead of hEDS, but that could be the only difference. Yeah, my kids have hEDS diagnoses now, but they do not have the same peripheral flexibility. My son, it's all hips and back, for example. Yeah. So they look at, you might run a genetic panel, you might get your Beighton score, look at my lovely bendy fingers here. You might get a Beighton score, you might, and then they look at family history. Do you have anyone else in the family who's diagnosed? Oh no, everything else matches, but no one else is. And maybe that's the issue. Your primary goes, okay, I can't do this now. Okay, take hypermobile spectrum. And somewhere along the way, you're going to run into a specialist who's going to be able to look at your family history and go, yeah, maybe they don't have the official genetics diagnosis, but it's there. I'll diagnose you. We can do that. Doctors can do that. There's more flexibility, is my point here, than they realize. And it just might take a little time to find the flexible people. Yeah, so find someone else with the diagnosis. What happened in my case was after I got the HSD and began working towards EDS, which are really interchangeable, I just used them back and forth and went with doctors. If they used HSD, I used HSD. If they used EDS, I used EDS. Whatever. But then my sister got diagnosed, and so now, voila, we were able to confirm hypermobile EDS. The other thing they look for is multi-system expression, and this is where you as the patient come into the picture. You as the patient, they're looking for mast cell type symptoms and dysautonomia for the trifecta of EDS. And one of the problems I see here very often is that patients discount their own symptoms. You're thinking separate conditions, you're thinking maybe I do, maybe I don't. There is a spectrum of dysautonomia and mast cells. They can be mild. They don't have to be severe, living life in a bubble with an EpiPen to be mast cell issues. Yeah? And dysautonomia doesn't have to be high levels of blood pressure medication and constant compression clothing or a wheelchair because you can't stand. It might just be an inappropriately elevated heart rate and some heat intolerance. So this final piece to the hEDS puzzle for you patients, do not discount your own symptoms. You have to be objective in your own history. Not manipulative of the facts, but objective, and that's very hard to do when you're researching for yourself versus someone else. You get online, you feel like you don't match what they have, and so you write it off. You can't do that. There are, for mast cell pieces, different types of allergies. My mast cell stuff is almost completely neurological, but I was surprised to find that what was normal allergies for me was actually abnormal for other people. I get the dermatographia, the skin writing, but then I'm allergic to things like prednisone, which is what they use to treat mast cell people. Everyone might have different expressions because your mast cells are different. They are more random. So you're not going to match. Don't discount your own symptoms. Present your symptoms. Present the allergies. All mast cells are more unstable right before your cycle. For every biological woman everywhere, your mast cells are more unstable on your period. So if you're not sure, but on your period you start to feel like you have the flu, you get hives, rashes, your allergies break out, you start getting diarrhea, maybe there's no skin involvement with frequent hives, but have you had them? Have you reacted to scents with, migraines with scents? There's more to this picture is what I'm saying. I can't go through all of it here, or this video would take forever. But do not discount your own symptoms when you are reciting your history and trying to give them the pieces they need to diagnose you, yeah? It's broad, it's bigger. Okay, that's all for now. I hope this helps, and please, if you guys just want to get together and do it online, it's not something I would charge for. We would just get together and talk, and I can find out more about what you're specifically dealing with and how you communicate and get this together even faster, okay? All right, bye y'all.